Hi everyone, welcome to my channel. My name is Beth Radiol. I am an American Board of Radiology certified musculoskeletal radiologist. My aim is to discuss research papers in a simple and easy to understand way so everybody can understand and benefit from scientific research. Today we're going to talk about this research paper that reports a new sign to look for bone infection. The paper is titled Ghost Sign on Diffusion-Weighted Imaging Generated Apparent Diffusion Coefficient Map, Additional MRI Diagnostic Marker for Extremity Osteomyelitis. This research was conducted at the University of Texas Southwestern Medical Center in Dallas, Texas. So first, let's talk about bone infection. Bone infection is also called osteomyelitis. This is when the medullary cavity of the bone gets infected. This is usually bacterial. Staphylococcus aureus or Staph aureus is the most common pathogen, causing almost 80 to 90% of all cases. But there are some cases of fungal bone infections and even viral bone infections. These are most common in older people, men, and diabetics. Another common factor for developing a bone infection is if somebody has a local trauma. Let's say somebody stepped on a nail and the soft tissues get infected. This can then spread locally to the adjacent bone and result in a bone infection. Now, the thing with bone infections is that the treatment is not always easy. Many patients need long-term antibiotic therapy. Some people also end up needing surgical treatment, which includes amputation, which is surgically cutting off that part of the body. So it's very important to recognize bone infection early so that the doctor can start treatment early and prevent the infection getting worse and needing more extensive treatment or even amputation. So one of the first things that the physician would do if there is a suspected bone infection is to get a plain X-ray or a plain radiograph. Now the problem is it may take up to 2 weeks for bone infection to show up on plain X-rays for adult patients. Also, X-rays are not very sensitive or specific for bone infection, which means that the patient may have bone infection and the X-ray would completely miss it, or that the patient may not have bone infection and the X-ray would still look abnormal, but it wouldn't necessarily give the physician a good answer as to what is causing the abnormal appearance. So one of the better imaging techniques to look for bone infection is MRI or magnetic resonance imaging. Now, magnetic resonance imaging uses a big, powerful donut-shaped magnet to get pictures of inside the body. Traditionally, when on MRI, when somebody is looking for bone infection, the two basic MRI sequences are looked at. These are called the T1-weighted images and T2-weighted images. T1-weighted images are obtained by using a short TE, which is the echo time, and a short TR, which is the repetition time. Now, T2-weighted images are obtained by using a long TE, or echo time, and a long TR, or repetition time. On the T1-weighted images, bone infection would have low signal, so the area would look dark. On the T2-weighted images, the same area that looked dark on the T1-weighted images would look bright. And this is a good correlate to see if there is bone infection. In most cases, this concordance of signal, as in the same area of bone is bright on T2-weighted images and dark on T1-weighted images, is often spot on for bone infection. And if there is any confusion at this stage, we can always get a contrast-enhanced MRI, which means that the patient is injected with a gadolinium-based contrast, which is a heavy metal-based contrast agent. These contrast agents are big molecules containing the rare earth metal gadolinium. It is usually injected into the veins of the patient. Now, gadolinium is paramagnetic, which means it looks very bright on the T1-weighted images. when we inject this gadolinium-based contrast into the patient's blood, we can effectively follow the blood and see how the blood is getting distributed in the body. We can see if there is excessive blood flow to one part of the bone, which could mean that it is infected. But in some cases, even this may leave room for doubt. And that is where this paper comes into play. So this paper is talking about yet another MR sequence called the diffusion-weighted imaging. These diffusion-weighted imaging is based on the idea that water molecules move differently if they are within a cell in the body than if they're outside the cell in the body. Diffusion-weighted imaging has been used in MRI for quite a long time, but usually we use it to see if the patient has a stroke. Diffusion-weighted imaging and another sequence derived from it, called the apparent diffusion coefficient map, are very good at picking out early strokes in brain MRIs. But in the recent years, there has been an increasing trend to use these diffusion-weighted imaging to evaluate bone tumors, soft tissue tumors, and now infection. The authors talk about a ghost sign on the ADC map, which they define as the disappearance of black bone on ADC map and the appearance of diffuse hyperintensity compared to normal adjacent bones in the setting of osteomyelitis due to diffusion enhancement. So what this means is that the bones are usually dark on the ADC map, but if there is infection of the bone, it looks bright, and the bone and bone marrow outlines disappear. Hence, ghost sign. This paper highlights that this particular sign is a very early indicator of acute bone infection, and it can be present even when normal bone contour is preserved, as in before the bone actually gets destroyed. The authors of the study looked at 178 cases to determine if the ghost sign on ADC maps actually works. And they found that the ghost sign on ADC maps is a good way to pick up early bone infection and to exclude early bone infection. They report that the ghost sign on ADC is a very specific sign for osteomyelitis with a specificity of 94.5%, which means that it can correctly identify patients without bone infection. So this can be a very useful test to rule out people who don't have bone infection or osteomyelitis. If you enjoyed this video, please give me a thumbs up and subscribe to this channel. If you have any questions or any other research papers you want me to discuss, please let me know in the comments below. I would love to hear from you. Thank you.